My name is Jeff Wang. I'm a spine surgeon from Los Angeles. I'm at the University of Southern California at the Spine Center.
What are your hopes for this conference?
Well, the main thing is just connecting with colleagues and friends and just getting an idea of the newest treatments, the newest evidence, and actually their opinions on how to treat patients with spinal disorders. I think that's the only way to really stay current, is to see what the thought leaders are thinking of and really looking at the latest evidence.
What are your expectations for the conference?
Well, my expectations are basically to try to enjoy it and try to take in as much information as possible. I think when you invite a group of thought leaders like this, you're going to get the best knowledge and the latest opinions. So for me, I just have an expectation of seeing what the latest technology is and the latest evidence.
How have the workshops been for you?
Well, I can tell you every workshop has been outstanding with the partner societies, with just the topics. They're very, very, very interesting. I think the main session for me has just been fabulous, just interacting with some of the leaders and, again, some of my friends and colleagues, and just hearing thoughts from all around the world. I think when you see an international conference like this, you see opinions from all over the world. It's so much more valuable than just seeing people locally, just in your country or just in your region. Seeing the whole global network of surgeons and getting their thoughts and opinions, that's very valuable.
How do you see new technology affecting patient outcomes?
Well, I think the main thing is to really understand how the newest technology, how it affects the results of patient outcomes. Because we hear about robots, we hear about navigation, we hear about endoscopic surgery, and these are all sort of the latest techniques, and we're very excited about it. But what I want to know are the expert opinions from my colleagues and friends, from the leaders in the world, on how they're doing, how they're using it. Is it really improving outcomes so that we can justify the use in our patients?
How important is face-to-face interaction compared to virtual meetings?
Well, I can tell you, I guess maybe I'm an old guy, but I grew up like talking to people, learning from them face to face. And I think these days with the video conferencing and Zoom, people maybe lose that face-to-face collaboration. A meeting like this, where you're interacting with people, that's when you really see the value. There's so much more value than being on a television screen or a computer screen. Seeing each other face to face and interchanging ideas real time, that's the most valuable thing.
What challenges do spine surgeons face?
I think the latest challenge is trying to understand which of the new technologies is worthwhile and something for us to adopt. And which ones maybe aren't so great and maybe not worth the cost, because I think cost is really becoming currently something we consider.
What advice would you give to aspiring spine surgeons?
I think it's an exciting time for a young surgeon, just given the advance of new technologies. I think it's really exciting for them. For me, I would just say keep an open mind. Keep an open mind, because those of us that are older, we've been through years of training and we've seen years of technology. We may have our own internal biases, but for the young people, you're entering the field, I kind of say your mind is an open book. Keep it that way, but at the same time, make sure that you look at the evidence. You have to base your judgments and what you do based on the science.
How do you maintain balance in your life?
You know, I think that everyone strives to make a work-life balance, and for me, I always feel like I don't have that balance, meaning I work too hard, which I think is good, because I think you always need to be aware that you might be working too hard and ignoring other aspects of your life. For me, I think it's not very specific. I don't think I analyze it that much. I think at times I just check in with myself and say, are you happy? Because if you have the right balance, you're going to be happy. So it's not about analyzing the work-life balance, it's looking at the results. And I think the results should be whether you're happy and you have a good quality of life.
What are your hobbies outside of surgery?
I love sports, love basketball, I like golf. I have a lot of outside interests, so, and also love my job. So for me, I have a very good balance right now. For me, there's a lot of things outside work that keep me happy.
What would you like to say to Dr. Samit?
Oh my gosh, he has done an amazing job. He's been very professional, and he has a way of making you feel like a friend. More than just a colleague. He's been fantastic. I look forward to working with him. I think there's some people that are very special, and it's hard to kind of quantify it, articulate it, but there's some people who are very special, and I can tell you he is very special.